Hi, my name is Marie. I have posted some videos previously for different surgeries that I've had in hopes that it will help anyone going through the same situation. In this case, I tried to find videos on this myself, which I could not. I couldn't find anyone's stories, so I decided to post a video about this. My surgery on thoracic outlet syndrome. I had the surgery 6 days ago. And I had a first rib resection and scalenectomy, and what that means is they go in and they remove your first rib and 2 scalene muscles in your neck that are not major muscles. I have thoracic outlet syndrome, which means that your artery on either side up here and your brachial plexus, which are a group of nerves that come down out of your neck and control your arms, those were being compressed. I had nerve pain in my shoulder, in my elbow, all the way down my arm into my hand. I have lost muscle and strength in my left hand from the nerve damage and compression. So that had to be taken care of right away, because once you have nerve damage, and sometimes, well, at some point your nerves are irreparable. So if you do have any nerve compression, it's important that you address it right away, because there is no way to tell when too late is too late. But once it's too late, it is literally too late. Arteries are a little bit more resilient and can repair themselves. I had, in my case, brachial plexus compression, the nerves, and then also arterial compression on my left side. I had, like I said, the surgery about 6 days ago. You can see my scars. They're just lovely. One here at the base of my neck, one pretty much on my chest. Hopefully those will lighten up. It's pretty major surgery. I mean, they remove your first rib. It's not anything that feels good by any means. So a little bit about my experience thus far. The surgery, obviously, you're completely asleep. You don't feel anything. I woke up in pain. I had an IV drip of pain medicine and oral pain medication, as well as some other IV medicine, anti-inflammatory, that was administered daily, and I would get injections of blood thinners so I wouldn't get blood clots. I spent 4 nights, 5 days in the hospital. Most people, it's supposed to be 2 to 3 days. You're 2 weeks wearing a sling so that your shoulder doesn't sag. I'm not wearing it right now because I have it propped on my chair. But 2 weeks in a sling, 2 months till complete range of motion is back. I am still in a lot of pain. I was in pain. The hospital experience was pretty terrible for me. I was in a lot of pain, had a lot of trouble sleeping. Today's day 6, it's better. I'm taking less pain medication. I'm probably taking about half of what I was a week ago. I'm trying to get off of it as soon as possible. Waking up, my hand was kind of numb. This part of my forearm is completely numb right here. I can't feel it. My elbow is completely numb. I can feel my upper arm. You can see also I'm like kind of breathing hard. My lungs are at half capacity right now. That's not something that they told me would happen, but it's normal. I guess when they remove your rib, your lung kind of floats up, and you get fluid in them. You get fluid around your heart. You got to walk and get that out of your system, which I've been doing. You also want to walk to prevent any type of blood clots when you're not on the blood thinners. Pretty much, it's terrible so far. Hopefully it'll be worth it. It's not something that's unlivable. And if you do have any nerve compression, I would suggest that you deal with it right away, because once nerves are damaged, they're damaged. There's no going back and fixing them. So once they die, they die. So for me, it was, I was losing strength and I was having weakness issues and things like that. So it had to be done right away. This was pretty much for me a very quick decision. Not one that I wanted to deal with, but needed to be dealt with, and I did. The recovery so far, I'm finally back home. It's nice to be home. That definitely helps. You can't really get much rest in a hospital when someone's coming in every 30 minutes checking on you and checking your vital signs or giving you medicine or blah, blah, blah. But yeah, the breath issue is pretty irritating. I get winded really easily moving around. I have to take like very deep breaths. I get winded walking. I get winded, you know, moving, just even like just like adjusting myself in bed or moving pillows around. It takes some time. They give you a machine that you have to breathe on to try to strengthen your lungs and increase your lung capacity. They definitely did not mention the lung issue to me until after the surgery, which it's supposed to be normal. My doctor said that it will come back in just over time. I'll get, you know, full capacity. So that's kind of frustrating, but you know, that's just, you got to do what you got to do, and you got to deal with it. So hopefully some of this information has helped someone in this situation. If you have any questions, you can send me a message or comment on the video, and I'll try to answer them. I didn't see anything, like I said, out there about it. So hopefully I'll be giving an update video, and hopefully this works. My feeling comes back in my arm. These scars don't look so terrible. You know, hopefully it's all worth it. Hopefully I have no future nerve damage in my left arm from any type of compression, and I can get my strength back. So like I said, hopefully that helped you all if you are in the same situation. As much as like it's terrible right now, I'm not having fun. You know, I'll let you know if it was worth it, but if you do have nerve compression, you need to deal with it right away, because you don't want permanent damage to occur, because there is, like I said, there's no turning back at that point. So anyway, thank you all, and if you have any questions, please send me a message, and hopefully I can help you, and I'll try to update you all. Thanks.